Good afternoon, everyone. Thank you so much for joining us this afternoon. We're going to wait just another minute or two so everyone can trickle in and join before we start today's discussion. Hi, everybody. We're going to give it another minute as we wait for everyone to join before we start today's discussion. Thank you so much for joining us. All right. We're going to go ahead and get started with introductions as other folks join us this afternoon. Good afternoon, everyone. Thank you so much for joining us today. We're ready to begin today's K-12 special webinar to mask or not to mask, implementing evidence-driven unmasking policies in schools. My name is Erica Vaverka, and I'm the director of K-12 at the Hunt Institute. Again, thank you all for tuning in for our latest installment of Homeroom with Education Leaders. To provide a quick overview of our hour together, we'll start with about a 30-minute moderated discussion with our panelists, and then we'll pivot to a Q&A with the audience. If you have any questions, though, throughout the discussion, please feel free to submit them using the Q&A feature on the bottom of your screen, and we'll do our best to address them during the discussion. So again, that's the Q&A button at the bottom of the screen. You can just type your questions in, and we'll do our best to get to them during our Q&A portion. We also will be live tweeting throughout the webinar. So if you'd like to follow along or tweet, please use the hashtag #EdHomeroom. And someone will drop that in the chat for you as well, so you can easily participate on social media. So today's webinar is focused on how education leaders are navigating the pandemic and making informed decisions on school health guidance for their students and communities. Now that states have largely eliminated school mask mandates, districts and schools in many states have had to make tough decisions on whether to change their masking policies and ultimately navigate how they can continue protecting student health while keeping kids in school. Here to speak with us today about this topic are three special guests who have had to grapple with making these decisions at various levels. And with that, I'd like to welcome Superintendent Chris Rakedahl, who is Washington State Superintendent of Public Instruction, Ronnie Dossi, who is the Vice Chair of the Chapel Hill Carborough City School Board of Education, and Alexa Sordin, who is the founding principal of Concourse Village Elementary School, located in the Bronx in New York. Thank you all for being here today. We know you're all incredibly busy, and we truly appreciate you taking the time to have these important conversations with us from all over the country and on both coasts. So Superintendent Rakedahl, we're going to start with you. In early February, you recommended to the Washington Department of Health and Governor Jay Inslee that the state remove mask mandates for students in K-12 schools and make mask policies a local health department decision. 1 month later, several West Coast states like California, Oregon, as well as Washington, lifted their school mask mandates, and now virtually no states require masks in school settings. Looking back at when Washington was making these decisions, could you talk a little bit more about your state's decision-making process and what the plan is for Washington moving forward?
You bet. Great. Thank you very much for having me again. I'm Chris Rakedahl, State of Washington Superintendent. Like every state, I think we built dashboards on public health, had this incredible partnership with our state public health. Obviously, the locals were involved at their level. And what we were trying to do through the entire pandemic, and what we had really talked to our public about in the state of Washington, was keeping our hospitalization rates low enough that we weren't putting a significant strain on the acute care system. That went through its ups and downs during the pandemic. But as we got through Delta, and we moved into this last winter, what we were really clear to our districts about was pay very close attention to the fact that Omicron is going to be really ubiquitous. This is going to be that event based on everything we were seeing in the epidemiology that was going to finally get to everybody. And I don't want to overstate that, but we knew it would be a very, very significant mass infection event. We had high vaccine rates in our state. Ultimately, I think the dashboard was clear to us that we ended up with a high immunity rate as a result of infection. So we came into January with a really strong sense that between vaccines and infection-acquired immunity, that our numbers were big, and as they begin to drop, the risk of not wearing masks was very different. It had impact on students, it had impact on social engagement. We were clearly seeing a lot of tension around the state in parts. So once the mask was no longer the same weighted variable to protect as it was before, because so many people had been infected and recovered, it shrank in our prioritization. So when we looked at that data, we ultimately concluded that there was an opportunity here to go a little quicker in removing masks. It turned out to be a pretty darn good decision in terms of the balance of the data. But that's where we landed, on the data, listening to communities, but waiting long enough to know that as that mitigation strategy was being removed, we weren't going to reignite caseloads in our state.
Thank you for sharing a little bit of that thought process and how you approach that in your state. Follow-up question for you. Actually, you know what, I'll hold that question instead. I'm going to move to Ronnie. Ronnie, in North Carolina, school boards are responsible for making masking decisions for their respective school districts. Chapel Hill, Carrboro City Schools, for example, made the decision to slightly delay lifting their mask mandate until earlier this month. I think it was early April. April 4th is the date. Can you speak to the factors that went into this decision and how you were able to come to a consensus with fellow board members?
Yes, thank you for the question, Erica. So back in August of last year, the Chapel Hill Carrboro City Schools Board of Education approved a resolution which required masks to be worn both indoors and outdoors for students and staff. North Carolina Senate Bill 654 required local boards to adopt a policy and also to vote at least once a month on whether the policy should be modified. So the board and our superintendent, Dr. Naya Hamlet, really closely monitored both local, state, and national trends related to COVID transmission rates and responses to safety protocols such as masking. And throughout the time, really our priority was around how do we maximize, prioritize the health and safety of our students, staff, and community. And so we sought guidance from a variety of sources, health experts. Quintana Stewart is the Orange County Health Director who fantastically partnered with the district in providing data and talking through issues and concerns. We also partnered with the ABC Science Collaborative, which is an initiative through the Duke University School of Medicine, which gave us access to medical and science experts, data and insights on some of the local, state, and national responses and recommendations. We leaned a lot on the CDC guidance. We talked a lot about what was happening across the state through updates from Governor Cooper and Dr. Mandy Cohen, the former secretary of the North Carolina Department of Health and Human Services. And we also considered what was happening legislatively from the North Carolina General Assembly. So in March of 2022, the board decided to shift from mask required to what we call mask recommended in indoor spaces effective April 4th. And as you can imagine, the board had some really robust discussions as we were considering a change to the mask protection requirement. So we had some questions about lack of vaccine access for children 5 and under, concerns around students, staff, and families with immunocompromised situations, the unknown impact of new variants. And within that, we looked a lot at data. And so we looked at, we had implemented in-school COVID testing. So we were able to look at some school level data trends, as well as data from our local health department around community transmission rates. We were particularly careful around state and national data on disease transmission, recognizing that the disease doesn't respect borders. And then we also considered hospitalizations and hospital capacity. We felt an additional responsibility to consider impacts on our local hospital system, as UNC Hospital in Chapel Hill offers care to patients from every county in the state and from several neighboring states. And we recognize that overly burdening the system with local needs could have even broader impacts across the state. We also considered input from students and staff and community members and vaccine availability. So the district hosted vaccine clinics, and we had a staff requirement around vaccines. We looked at other school resources, ventilation, cleaning, et cetera. And then we also, again, considered sort of what was happening politically in terms of pressure from the legislature to reopen. And ultimately, points that guided us toward consensus were that the trends didn't indicate high rate of disease in young children. We were seeing higher uptake of vaccines, so we also saw lower symptom severity. So we know people who are fully vaccinated against COVID-19 are at lower risk of symptomatic or severe infection. We also were in an environment of declining hospitalization rates. We know masking is one element of safety protocol, so we thought about how do we strengthen other preventative strategies, encouraging students and staff to stay home when they're sick, making sure that our cleaning protocols were very robust. And then we also spend a lot of time thinking about the political pressure, which threatened to remove future authority from districts to make local health decisions if we did move quickly on the mask protections. So there was a lot of conversation, and ultimately, of course, we did end up making the decision to shift to mask recommended.
Yeah, no, it certainly sounds like there's a lot that went into that. And I know you mentioned vaccine clinics as a way to do outreach to the community. And you also mentioned, political and public opinion being important in terms of how you're framing your decision. So just curious how else you were able to incorporate student, family, and community into these conversations and decisions.
Yeah, we did a lot to solicit community input. We are very fortunate to have a very engaged community. So we have consistent attendance at board meetings. We heard a lot of public comment around, either health experts presenting data or community members sharing their perspectives and the impact of the disease on their families and their personal situations. Again, we focused a lot on data, which I think helped. So, the community pushed us to really identify what data we would use to transition. We were one of the districts in the state of North Carolina who made the decision later on. So some districts moved faster. But again, we felt like we had an obligation to really prioritize our understanding and community understanding around sort of what could happen when we made the decision to transfer. So I'd say an overall communication plan and focus on the data helped with that communication. I'll certainly say, it was not an easy decision. I don't know that, I would imagine that there's some folks who disagree on both sides about the timing, but we certainly continue to rely on the science and the data and our health experts to help inform those kinds of decisions.
Absolutely, certainly can appreciate that. And I know for myself, even, not only are there differing opinions, but also opinions that change over time, just based on folks' comfort level and perceived safety. So appreciate you sharing a little bit more about your process. Alexa, excuse me, going to turn to you. Concourse Village Elementary School, which is of course based in New York, where you are, serves a diverse community of students and families. 10% of the student population are English language learners and 20% are students with disabilities. As the founding principal of your elementary school, how has your school navigated changing school health guidance, and how are you communicating these policies to a diverse group of students, parents, and families?
Hi, thank you for having me. I'm really excited to be here with these awesome panelists as well. We've been navigating the changes by breathing deeply because we're not part of the decision-making process, which was just described. We're actually the receivers of the information. So making sense of it and saying, okay, what does that make? How do I explain that to a 3-year-old versus a 5th grader, an 11-year-old? And how are we having conversations about keeping our community safe internally and then sharing that with our staff and our families? So some of the practices we have used that have served as successful for us is we send a lot of text messages to our families, very short blurbs about updates that are going on. We send YouTube links. We make YouTube videos modeling this is an example of what it means to be safe in school. We talk about what do you do if you have a cold? But if you're not feeling well, I know that masks are recommended. However, this is a great opportunity for you to wear your mask because I want to come to work. So I need you to wear your mask so that we're all safe and healthy. So we have constant conversations about, oh, it looks like your nose is running. It looks like you're coughing. This is a great opportunity for you to wear a mask. I know it's your choice, but this is important for our community. So just a lot of constant reminders, a lot of communication and simplifying the communication and also communicating what's relevant to the population that it's relevant to. And because I'm in a 3K to 5, all of our children that are 4 and below must wear a mask as the staff as well. Whereas the other folks have the option. So just sometimes it feels like a disconnect for that staff member that's like, but that, everyone else is not wearing it, but we have to wear it. That's part of the policy and understanding why it's a policy. And we look at, well, there's not a vaccination option for that age group. This is why it's important that you wear your mask. So just a lot of communication via text message, videos, communicating updates, showing the expectations, still masking when we're not feeling well and serving as a role model ourselves when we're not feeling well. I have morning meetings with my children and the teachers also have morning meetings when they start their classes. That's another opportunity for us to send reminders. And then we just keep our spaces really clean. We sanitize with every transition. We still maintain somewhat of a distance within our classrooms and always wipe all the materials consistently so that we could keep each other healthy.
Great, thank you so much. Can you share, and I know you just shared some, love the YouTube video ideas, so you also have a visual guide, but could you share any other particular successful practices that have helped students and families acclimate to health guidance, particularly those with unique needs?
I would definitely say we lean on our core values. Like one of our core values, we have 6 core values, 2 of which are respect and empathy. So we really highlight those and I will definitely say we've been blessed to have an easy transition and everyone has worked well together. For example, we still have a you can't come into the building if you're not vaccinated policy. So that was communicated often with families, like if you're not vaccinated, you cannot come in. You need to text us or call us to let us know you're on your way. And just constant reminders. We also have an Instagram page and we put videos on Instagram and we send reminders so that everyone is aware of a policy that we must uphold to make sure that the community is safe. So I think just a constant communication, being very visible and transparent with our families and just explaining that this is not about me, it's about us and our community. So we've had really great success just through the constant conversation of this is what's happening. And because our parents have access to us via text message, they will text if they have a question. And we're always very responsive as a community, myself and the teaching staff. So just the constant communication, I say, has been a success for us.
Thank you. Yes, constant communication feels like it's been key for everyone on here. So really appreciate everyone's insights. And I just have one follow-up question for all panelists to respond to. And Superintendent, we'll start with you. As we've discussed for the past several minutes, now that states across the US have lifted their mask mandates in schools, districts in states without mask bans are considering their unique situations along with public health guidance backed by data and research. Hearing from you all, these decisions clearly happen at all levels and require multi-level coordination. Looking ahead, how could schools, districts, and states best collaborate, communicate, and align their needs and priorities throughout this process? Superintendent, we'll start with you.
I appreciate that question. I appreciate the Hunt Institute really focusing on these 3 levels. I think folks have just heard sort of the statewide policy. How did we approach statewide policy? How does a local school district board member approach it? And then how does a building leader with that much more day-to-day contact with parents navigate this? So I appreciate all the frame that is around this. You know, Washington State's unique, and as I always say to folks, there are 50 different contexts for this. Never want to presume that we have the answers. What I will say is our obsession with data, and everyone says they're obsessed with data. I think we're kind of obsessed with data in this state, to the point that the politics of folks who had different opinions, the ideology of this, the sort of national culture war that came to be masks or vaccines, we felt all that pressure. But I'm thankful to work with a governor where we didn't ultimately use any of that pressure as the reason. And it was there and it's informative. But when the data changed, we changed. So my recommendation to everybody is, on the front end of anything like this, figure out what matters from the experts. And in this case, a public health crisis, it was public health officers. These are folks who are expert in epidemiology and virology and really these critical issues, right? We as educators were not the experts. So our state on the front end was awfully heavy to say, we're not going to leave masking decisions from one district to another, because you've got 5 locally elected school board members whose statutory focus is on schools. They're not public health experts, and they're much more likely to get whipsawed on the politics of this. So we took a lot of that decision making away early and said, we're going to listen to state public health experts. Then, as we thought the data got under control, when the data and the research told us it was safer, the state policy rolled off. And then we said, hey, there are still reasons why at the local level you're going to have outbreaks and make a decision. We still don't recommend that that's a school board making that decision unless it's in total alignment with the local public health officer. Let somebody who is expert in public health and, again, these issues of virology, let them get to the conclusion if a masking requirement needs to come back on, or a closure needs to reoccur, or something else. My recommendation in education is stay in our focused area, which is student learning, which includes social emotional learning, but we ought not make public health decisions a whole lot because it tends to be, and I think we've now observed that the politics and the ideology of this kind of dominated the science in some places. So get your dashboards, focus on the data, know who the expert is in that particular issue, and let the experts guide the policy. And in this case, it was public health.
Ronnie, I'd like to hand it over to you next.
Yeah, thank you for that. I would say we can certainly imagine that we'll see other global issues like COVID-19 that'll impact multiple agencies and states and levels. And so I think what a key learning for us is really thinking about how we create proactive plans that enable us to get that alignment to those health experts and to those organizations that can inform what the school level decisions should be. I will add, I do think it's important that schools have a voice in this, because there are sometimes things even within a district that are different between the school buildings that are important to understand when we're making those decisions. So I think it certainly needs to be a collaboration informed by health experts, but with the folks on the ground in the classrooms having significant input. Because I think what we missed a lot in this was people focused so much on the students that there wasn't this consideration all the time about what about the staff and the teachers who had to be in the buildings. And so when people talked about we're not seeing high rates of transmission in children, there wasn't always that connection to, but the teachers have to be in the schoolrooms and the buildings, and we are seeing higher transmission and we are seeing higher symptomology in those adult populations. And so that's where I just make sure that we're really respecting the voices of the people who are in the classroom doing the work. The other thing I'd say is build really robust mechanisms by which we collect and share data. I think what we saw is that we were building a lot as we were going along. And so there were situations where data was perceived as less credible because of that, right? And so I think looking ahead, how do we make sure we understand data in such a way that we're better able to anticipate what's coming, but also make sure that we're clearly collecting and communicating data in a credible way that people can make decisions around. And I think that also requires us to make sure that schools and health agencies have sufficient resources. So I know some of the data systems aren't fully developed across the state agencies, and certainly not at the local school and district levels. And so thinking about what that would look like as we look ahead into what's possible in the future.
Absolutely. Thank you for those thoughts. And Alexa, I will hand it over to you to close us out before we jump to the Q&A portion. So if you haven't already, please take the time to post some questions into our chat. I'm sorry, not into our chat, into our Q&A feature, and we'll get to those next.
So when I think about how to best communicate or align the priorities looking ahead, something that was for me as the principal that was unique is like there are different policies for different sectors. So a charter school may have their own policy where I'm part of a system, New York City DOE, and then a parochial school may have another policy, and then an independent school may have another policy, and parents will hear the news and they'll say, but this is no longer in effect. Well, for that sector, not this one. So when I think about when states and everyone communicate, I was visualizing like a graphic. It's like something very simple that explains like this group has the option to implement the policy as they see fit, whereas this school is part of this domain and they must follow this policy, so that we're all on the same page, parents, teachers, families, and everyone in the community. I think about simplicity when communicating. Sometimes a lot of technical language goes over our heads, mine included. So it's like, okay, how can we really simplify this so that it makes sense, with the focus being safety? So we all want to be safe. So what's the safest way for us to proceed? And can we simplify that without all the technical terms and just get right to it? And making it overtly obvious when a policy changes, because we're not in the room when it happens. So thinking about like, this is the new part of the guidance. This is now new as of this date. So that is just overtly obvious to all of those that are helping to implement the policies that are being set forth.
Yep. Thank you so much for that. Now we're going to turn to the Q&A portion of our discussion. And the first question that we have, which is for all of you, is, do any of you have experience with navigating state laws that prohibit mask requirements, regardless of student age or vaccine status?
I will say in the state of North Carolina, I appreciate Governor Cooper and kind of allowing districts the latitude to make some of those decisions. So I have not engaged with that question personally, but I will say I have colleagues in other states where I know that they faced that kind of environment, and it really became a question of that fell upon the shoulders of families to make decisions, which seems to be not the best way to make health policy decisions, right? Like we understand that we're all connected in this, and what happens to one of us affects all of us. So I don't know what the intent of the question is, whether there's any guidance on how to navigate that. I don't know that I can offer any specifics to that.
Really two different directions here. There's one thing for a state or a government entity to require something. And in our case, the state of Washington did require, and then when it got safer, we stopped the requirement at the state level. It's very different to prohibit a local jurisdiction with its own legal authority not to do something in the best interest or safety of their community. That it's very unusual. We had a couple of legislators here, flare about the idea and got no traction. We definitely know there are states though who pursued this. I do think it's an interesting legal question. The courts across the country mostly held up governors' emergency authorities. There hasn't been a significant enough case yet to question whether or not a state government can prohibit another local jurisdiction from doing something in the best safety interest of their community. Those are two very different things. And I suspect we're not done hearing from the courts on whether or not these mandates coming out of legislators or governors that prohibit masking policies can be upheld.
Thank you so much for both of your insights there. Moving on to the next question. Again, any of you can jump in here. I know you'll have a lot to share. Generally, how has this journey of navigating the health requirements and decisions related to COVID-19, how have those impacted how you will approach health concerns in the future? And are there any lessons or best practices that you'll carry forward?
Oh, that's a great question. Certainly lessons. I talked about, looking at data sooner to try to anticipate where we see emerging issues, thinking about the other safety measures that we've implemented and maintaining those. So, as we talk about cleaning and ventilation and, proper care of our facilities to make sure that the spaces in which our kids are being educated are appropriate and safe health-wise, as well as other safety measures. And then just thinking about communication. So how do we do a better job across, agencies and education entities and nonprofits and community members of understanding what risk is and how we mitigate it and to some extent how we might have to live with it in some instances.
I think our lesson is probably going to be on the communication side. There's a cycle actually in the literature that we studied on the front end of this. I'm very grateful we did. It actually came from our health folks, and it's sort of the cycle of crisis. And in the beginning, there's this rally mode and we can do it and the energy's high. And then there's a duration to it where you sort of get defeated and there's this hopelessness. And it kind of followed that both in the country and in our state. And I think what's interesting is along the way, we had this sense of us, right? We is greater than me. And we had this sense of shared responsibility. And when that started to break down, I think we probably should have doubled down on that. Masks were never about protecting us. You're still taking an error. Masks was about, what if I don't know I'm infected? How do I keep my droplets close to me so I don't impact other people? And boy, did that spin out in individual rights conversations instead of shared responsibility conversations. So if anything, I think the communication of why we do things in the best interest of each other, that could have been a really impactful lesson for students. And I think on the front end, we were decent at it. And I think by the end, social media won. And the lesson for students was pound on the table for your rights to mask or not to mask, to vaccinate or not to vaccinate, which are important debates. It just didn't end up getting paired with what is your responsibility beyond your rights? What is your responsibility to your fellow human being and those who are more vulnerable? I generally think our students did a much better job in this dialogue for the last 2 years than a lot of the adults in the country. But it's one thing I think as we go into the next crisis, whatever it is being intentional about the way we communicate our shared responsibility to each other. I think it could have kept the temperature of all this a little lower longer.
Great, thank you both for that. Our next question that we have in the chat, Alexa, certainly think you'd be able to speak to this as well. Are you seeing any shifts in school policies restricting outside visitors? And how long do you see these types of restrictions continuing?
For us, currently, the restriction is if you're not vaccinated. So parents that want access, we have given access if they just want to spend a period in their child's classroom or tour the school. We have allowed it as long as they can provide a vaccination card, because that is the policy that we're upholding at the moment. I foresee that most likely remaining because it's again, it goes back to how are we keeping everyone else safe and knowing that if someone's unvaccinated, how will the teacher feel about that? And what about the other children? So we have definitely opened our doors to all parents that are vaccinated.
Part of our governor's emergency declaration, there are many component parts and most have rolled off now, but one that stays intact is a vaccine requirement for our educators, all of our staff in schools, which did include contractors and parents who wanted to volunteer. So we know it's one of the last things that will come down. There's no timeline on it yet, but there's no restriction for our students to come into our buildings, even pre-K, even though they're not vaccine eligible. So all of that has been in place for a while, but yeah, it is still a bit of a challenge for someone who wants to come into our school who doesn't show proof of vaccination, as Alexa just said. We did have 2 exemptions in the state. We had a religious exemption and a medical exemption. Very few people took that. Unfortunately, very few people didn't vaccinate. Our state education system ended up being 93, 94, 95% vaccinated. But yeah, it remains a bit of a controversy, and like how long will that last before any parent who wants to come in can come in? It's still a little bit of a challenge until that last part of the emergency declaration goes away.
Thank you. Next question, and we touched on this a little bit during our moderated conversation, along with physical health and masking, we have also seen an increasing concern around mental health in students. Have you seen efforts from states, districts, or schools to bring in mental health care as we continue to focus on physical health care?
Yeah, I would say we have certainly recognized both locally and nationally that we have seen significant impacts, both in adult and student mental health needs. And so some of the ways in which we try to address that issue is we have sought funding for psychologists and counselors in all of our high schools. We have worked with community partners to co-locate some mental health resources in some of our elementary schools, and continuing to have conversation with our local county commissioners and cities, city governments to think about how we more broadly support families. Because what we also know is like, it's not just the students. We've seen a critical impact on the students, but what the students bring to the schools also exist at their homes. And so how do we support the broader community as well? And I think what we're seeing is we wish we could go back up the supply chain and build it up. So we're not really even able to hire that we need around this support because they just aren't available. So I think really be proactive in thinking about it. This goes back to a previous question of like, what do we think for the next thing? I think mental health is a really important part of that.
Yeah, I'll just add, this was certainly a building problem, a growing challenge for our students and communities pre-COVID. So one of the things we try to help people is, again, take the ideology out of it. We did not suddenly have mental health challenges because of COVID, because of school restrictions or masking or vaccines. This was building beforehand, and there's a lot of variables that I think come into play. What this did allow us to do, though, in our case, is we went to our legislature this last cycle, something I had previously proposed. This time we got it done, over $300 million permanent annual funding for school psychologists, mental health coordinators, nurses, counselors, parent outreach coordinators. Our state has what's called a prototypical funding model. So based on the size of your school, you get so many administrators, teacher certifications, all that. We were really thin in that area. And what's really neat is we said to the legislature, these American Rescue Plan dollars are going to roll off at some point. We built capacity here. And to run Rainey's point, yes, huge challenges in finding these folks. But we did know that we'd get through this and these federal dollars would go away. Then what? How do you sustain that? And we were very grateful to be in a state where our legislature said, we agree, let's put the state investment in now so that as you make commitment to hiring more of these folks, you don't have to just let them go in 2 or 3 years. So the build in terms of the capacity and support is great. And then we do have 9 regional educational service districts in the state, and we put a very large contract using those ARP dollars, the Rescue Plan and ESSER dollars, into their hands so that they could build community mental health models. When there is a challenge in a school district and they do not have the resources, a school psych or a mental health expert, they immediately pick up a phone, call their regional coordinator, and they have a cadre of people they've contracted with in the community who can offer direct mental health support for students. So there's some great solutions out there. Sometimes they require money, and I know all the states are in a different place. We were really blessed to have a legislature that said, let's not wait till the money falls away from the feds. Let's get after it right now.
That is fantastic. I love that sharing. Thank you.
Yeah, really great. I don't think you've spoken about this during our time, but are there specific tools or resources that you use to make decisions around larger requirements and initiatives to protect student and staff health? What information are you looking at to feel that you are making the best decision for all stakeholders?
Just 2 quick things from us. We have a screener requirement of all of our districts, so they all have to have some tool in terms of mental health screening. And then University of Washington is one of many partners, but they have a very robust database. So we get regular reports on everything from the number of referrals or I would say services offered in acute mental health settings, all the way to suicides, youth suicides. It does have a leg to the data, but we monitor that every single month to know on the front end if something's building, and then obviously on the most horrific end. What we definitely saw was what the research told us 2 years ago we would see. it said you'll actually see a decline in youth suicide because there's this point at which everyone's sort of in it together. And then as the duration lasts, you'll actually see those numbers bounce back. And that's exactly what happened in our state. We went from about 85 birth to 18 suicides pre-pandemic down to about 45 to 50 for the 2 years of it. And we're kind of right back to those pre-pandemic levels. And again, it's something we monitor very, very closely as indicators. We use it as evidence with our legislature, but we don't just use that metric. On the front end, we've asked our school districts to have some kind of screening tool that they use so that they can be kind of tier 1 on the front end of risk, so that we're not looking at terrible, terrible data down the road.
Yeah, one of the things we've done very tactically is to implement social emotional learning across all of our levels of our schools. And so we have everything from some classrooms that start the day talking about mindfulness and hearing how a student is going, and using some of that information to think about how we better serve them throughout the day. And the other thing is partnering with our community mental health providers and other kinds of health providers. So we have a nurse in every school, and we're trying to make sure that we continue to advocate for that to be the case across the line. And we're very fortunate in our district that we have a community that really values the investment in education, and we have a local supplement that enables us to have some additional resources. But we recognize again that it's important for all of the students in the state of North Carolina to have access to the resources. The other thing I'd say is continued partnership with our local health department and the state health and human services groups, and work state organizations like our state school board, county commissioner organizations, to really just have conversations of what we're seeing across the state that may be coming, and what tools are effective that folks are finding in other areas.
In our school this year, we piloted the Panorama Survey, which is an SEL tool, and it asks questions like sense of belonging. So that's like one, and children take it 3 times a year. They took at the beginning, they took a mid one, and now they're going to take another one, which gives us data to see how students are feeling or how they are perceiving how they belong in school or in their family or what have you. And then we've used that to start conversations with children, because we were actually surprised, like some of the outgoing personalities, the data wasn't matching. But then when we drilled down and had conversations, we learned about things that were going on at home that we couldn't see in school because it didn't match what we would normally be looking for.
That's really fascinating. Thank you so much for sharing that. And I want to touch back on this conversation about parents, and depending on vaccination status, parents might not be able to come into school buildings. We know how important parent engagement is for student outcomes. How do you engage with parents when they're unable to come into the school building?
I would say there's a lot of ways that you can engage without being in the building. So we are looking for, we have a lot of volunteer opportunities that might be in more limited space capacity. So tutoring or mentoring after school. And I think we'll continue to think about what re-engaging in the school more broadly looks like. This year, we've certainly had to focus on just what's in front of us, like getting the kids back into the school, instruction in the classroom. And there just wasn't a lot of capacity to like introduce other variants into that space. So I think we're continue to think about that, but I would encourage parents to think about where else, there's a lot of opportunity for advocacy. We know that education funding continues to be challenged across the country, particularly in the state of North Carolina. And so how do we engage in those things that might not have as immediate a return as being in a classroom, but are incredible to the future of schools and kids learning?
We continue to utilize Zoom and just have conversations. Like that's the one thing that that was always there that we didn't utilize until the pandemic. So we continue to definitely engage our families through online conversations, again, text messaging, and then recording important information and then sending YouTube links so that they could watch at their leisure so that they remain informed.
Yeah, and in our state, it's very locally determined. There is a state policy on this. I will say the feedback from our field is, even with the vaccine requirement still in place for all of our volunteers, our educators, and our contractors who come into our buildings, again, in our society, in our state, 85% of adults or so are vaccinated. And so it just wasn't that big a deal. We're talking about a handful of people who insisted on not vaccinating, insisted on not filling out a form on why they took an exemption, and still demanding that they become volunteers. And, you know, it's a little tough. We're in this tough world, but I have to deliver tough news to folks, which is you don't have a statutory right to volunteer any more than you can force your way into a doctor's office and volunteer for the doctor. Schools are employers, and we are blessed to be publicly funded, so we have to be very responsive to the public, but we don't have a right to be in there unless we follow the same rules. And for 99% of the time, it's awesome, and we want folks in our schools, and they add huge value. In the middle of a public health crisis, when vulnerable adults are losing their lives to the tune of 1 million people in the country, that is not the time where we get to pound the table and demand we get to be somewhere without certain health protections. You don't get to volunteer for the fire department unless you put on fire gear, if they're willing to take you at all, because they're not going to risk you getting in trouble, and they're not going to risk the firefighter team or the people they go in to save. So these are really tough conversations where, again, if we had that focus on civility and that sense of us, we could get past this idea that I demand to do what I want to do when I want to do it. That just isn't actually how America's supposed to work.
Thank you. And on that topic of masks, on vaccinations, on those health benefits to ensuring student and staff are as protected as possible, does requiring things like vaccination and masks, I know it's masking optional, but does that provide a sense of security to those who may be hesitant to gather in person and help get students who may have been missing from virtual learning back into the classroom?
It was a huge part of our conversation. For us, it was a partnership where we were talking to local leaders, elected and non-elected. We were talking to parent groups, students, labor leaders, business leaders. And when we were really focusing on getting back into the classroom, what there was, for every parent that really didn't want remote learning and didn't want a vaccine requirement or mask requirement, we had parents who said, I won't send my kid back until there's better safety precautions. So this middle ground that we tried to find was, keep masks on a little longer than most states did and go to the vaccine requirement. And as soon as those were in place, there was a huge consensus to open our buildings faster. So it helped a ton, I would say, for us when we were in the middle of all of the contemplation.
Yeah, and I would say, we talked about earlier, considering there are many different elements of what safety feels like to different families, right? And so we really wanted to make sure that we had heard from a range of people who made sure that, sorry, I lost my thought. I'm sorry, can you repeat the question again? I had a thought and I lost it.
Absolutely. It was, we were talking just about the health benefits, that masking, vaccinations provide, and making folks feel safe. Yep.
So I thank you. I've now reconnected my neurons. So it was about layers of safety protocols that people were considering. And so for some people, they were comfortable with vaccine and mask. And for some people, they were comfortable with just mask. And so as we, kind of got to higher levels of vaccine, I do think there was a higher level of comfort. We did hear from a lot of the parents who don't have access to the vaccine yet, that they had concerns about returning. But certainly what I heard from the community was these kind of multiple approaches toward COVID safety increased confidence in people's willingness to come back to the buildings.
Great, thank you. I think, for us, we love to end these conversations on a positive note. Would love to just do a brief round robin. If you could share a lesson learned or development from the last 2 years that makes you feel hopeful about better serving kids and family health moving forward.
Well, I'll go back to what Superintendent Chris mentioned earlier about the messaging of how all of our success matters. Sort of, an analogy has been we're on a boat, and if you decide that you a hole in your side of the boat, it matters to everybody else who's on the boat. And I think we have to think about community safety in that same way, that, our individual decisions aren't necessarily only impacting us and our families, but there's a broader consideration to be had around our community members, and particularly our most vulnerable, our students and young people and folks who have, immunocompromised, allow them access to the same protective measures that we might have. And so I think my learning is really framing that communication, but also continuing to advocate to have the right resources to keep our school buildings.
Thank you. Alexa, would you like to go next?
Yeah, something that I've definitely learned is that it's better when we're together in school, in person. So in-person learning is amazing. It's awesome. And we want to stay safe, and so that's what we communicate to our families constantly. So this is better for everyone. It's actually better for our own mental health, our own emotional health, when we see their smiling faces and when they're in school every single day. So what I've learned is that we are just like that boat analogy. I totally love it. It's just that we're all in this together, and we want to be here for our children. So we need to think about that sense of community, and let's help each other stay safe so that we can continue to learn together for many, many years.
Yeah, I'm very grateful at how much our students learned about themselves through this. This is a tough lesson to learn in a tough time. But this country it's been a long time. It's been really 7 decades since this country felt the immediate day-to-day impact of a global crisis. And that generation that came out of that had to make genuine sacrifices in real time for the greater good. And it was hard then and controversial, and it's hard and controversial now. But I do think our students leave with a better sense of who they are from a learning modality, right? I'm with Alexa. For 90% of students, it was a breath of fresh air to come back, because even they said, I didn't realize how much I learned from my peers and the energy I got from my peers, and they want that. But for some percentage, and I'd say it's probably 10% in our state, they said, ooh, I really like that. I want more options in the future to learn remotely or to get content differently. And so we've got lots of learning academies now that are with us forever. We had some before, now we've got them at greater scale. So students learned a lot about how they learn and when they learn and what kind of model fits them best. And they learned a lot about getting through hard things, especially in an era where their social media platforms are giving them the negativity so constantly. They actually have pushed through something and said, wow, we did something here. It's better now. Vaccines have helped. Not everyone wants them, and that's okay. We closed and we saved lives, and we got through something hard, and now we're rebuilding and recovering both our learning and our economy. Like, young people are going to have a perspective on this that kind of hasn't happened in 2 or 3 generations, and it's tough to lead through that. But I think they're going to be amazing future leaders who are both cautious about things like this and also more hopeful when it happens, to say, hey, we did that. We remember when we did that, because we can do it again. And we kind of lost that a little bit here. We were all navigating something for the first time in 100 years in terms of a pandemic, and 75 years since a true global crisis. And we battled through, and I'm grateful for the resilience of young people.
Yeah, I would also say I'm excited that we have started to put these conversations in place. Like, before it was more, I think, opportunistic that we'd have conversations with the health department, but now we're much more intentional about that at the local and state level. And so I think continuing to build some of those relationships and again, kind of the platforms that enable those conversations are going to be really important. And having started those is a little bit of a, up this whole pandemic.
Absolutely. Thank you all for those closing thoughts. And thank you all for your time today. This was an incredibly interesting conversation. I've learned a lot about decision-making behind school health guidance and how states, districts, and schools can really align coordination efforts as they move forward from the pandemic. So I want to give a special thank you to our panelists today for our wonderful discussion and for answering our many questions. It's truly been a pleasure speaking with you all, and I hope all of you in the audience enjoyed our conversation as well. We also hope that you will join us for our other upcoming homeroom webinars. Our next webinar will be on Thursday, May 19th at 2 p.m. Eastern, on how perceptions and policies around school choice have shifted as a result of the pandemic, and how educators and policymakers can provide parents and families with access to the information, resources, and supports needed to ensure their children are receiving a high-quality education that meets their needs. The team will drop in the chat the registration link for this webinar, so you can make sure you are with us in May. And then I think the next slide, our next slide has our other upcoming Hunt Institute webinars. We'll post a link to our upcoming webinars page in the chat feature, like I just mentioned, and we encourage you to please go ahead and register for the topics that interest you. So thank you all so much for your time. Thank you for joining us for another Homeroom with Education Leaders webinar, and enjoy the rest of your day. We'll see you next time.
Thank you so much, Erica, and gratitude to the Hunt Institute for its continued work.
Thank you so much. Always appreciate you.
Bye, Chris.
See ya.